So good afternoon, everybody. It is Thursday, as always, May 13th, 2021, and we're here for the weekly Nevada County vaccine and COVID update. And I believe that at least 3 out of 4 of us here were probably watching the news conference, the CDC news conference with Dr. Rochelle Walensky and Dr. Anthony Fauci, where there has been some updates to the guidance for vaccinated people. But before we get there, Ryan, can you kick us off with where we're at here locally, because this is about Nevada County?
Sure. So in Nevada County, we have 78,727 vaccines administered for Nevada County residents. That's obviously tremendous progress since the beginning of the pandemic. Hopefully we'll get past 80,000 this week and get to celebrate that milestone. We have, according to the state's website, 51.1% of our population over 65 fully vaccinated, 10.2% partially vaccinated, and then 48.4% of 50 to 64, 14.2% partially vaccinated in that group, and then lower percentages as you kind of go down the age range. That's a lot of progress since the beginning, but not enough, and not what we need in order to achieve quote unquote herd immunity. Some counties are significantly ahead of us, and the issue right now is really uptake. We've got plenty of capacity, we've got plenty of vaccine. It's just filling those appointments. And so we're doing everything we can. The public health team is working very hard to make it as easy as possible to get your vaccine by allowing walk-ins at the Sierra College Clinic, by easing up things as it relates to the second shot, and then focusing more and more on how we get to the hesitant communities or those that need additional help to get those vaccine appointments. And then the big news today, as of today, kids 12 and older are eligible to start getting the vaccines at our Whispering Pines clinics, which we have at our Pfizer clinics, which we have at Whispering Pines through Public Health, Docomo's, and then in Truckee, I believe it's through Tahoe Forest Hospital and CVS are providing vaccines to 12 and over. So I think I'll stop there.
Yeah, because I think that unfortunately we are still in the top 3 of cases per 100,000. I mean, there's only 2 counties, sparsely populated counties ahead of us, but we're still in number 3. So there is still we still have a certain number of daily cases that are coming in. And also I noticed that hospitalizations have gone up. I mean, not significantly, but even 2 people in the ICU, that's at this point in time, it's I really feel for the people that are going through this right now. So that's one thing, but the good news is, of course, that kids now can get vaccinated. And can we talk a little bit about the process? Who needs to be with them? Who needs to say yay or nay? And we have a couple questions. And interestingly enough, one of the questions is from a kid a minor who said, well, what if my parents say I have to and I don't want to? So
well, Pascal, that's probably helped. That's probably happened in child rearing along the way. I know it's rare that kids always follow parental advice, but it's a conversation.
I mean, he sent it with a smiley face. So
well, I know, I get that, but it is a conversation, and no kid's going to be coerced into immunizations. It's not going to happen. I mean, there's a chance. Probably the kid knows more about the science than the parent. Kids probably Google it all, knows about messenger RNA and about ribosomes and spike proteins. So maybe the kid will have a chance to educate the parents. But it's all about a conversation. And if the kid is reluctant today, if they brought him into Whispering Pines and the parents say he's ready for immunizations and the child says no, then our nurse Donna will come talk to him. And if the kid says still no, she'll turn to the parents and say, schedule another visit. We're always here. We're available for you. We're willing to help in any way. But it's a conversation. And my guess is that they you know, if they have the conversation with the kid, that they will both come in with smiles on their face, anxious for immunizations. But it is a conversation. We're not, you know, no kicking and screaming in any of our vaccination sites.
I think with 12 and older, that is true. You do want to have a conversation. I think we might be in the position of children convincing their parents to let them get vaccinated and use good science to do that. But I beg to differ about not forcing children. I can tell you that my 2-year-old, my children, when they were 2 years old, none of them wanted their vaccines. Neither of them did. And we still gave them their vaccines. So it depends on the age. And there are times when parents know better than their children, and you do what's right for your child.
And I have to say the questions that we got from minors, there were more questions about if they could get authorization or come with either an older sibling or an aunt, because parents are unsure, and the kid wanted to get vaccinated because they want to get back to their friends and activities. And that's why we got a couple questions. Is it okay for my aunt to come to bring me and give me authorizations, or my brother who's over 18? So those are also questions. And I think there's going to be conversations, probably quite a few, but it's interesting to see. I mean, there was a lot going on. Something else that of course just popped up on the CDC website is the new public health recommendations for fully vaccinated people. So that press conference just happened, and the update is fully vaccinated people no longer need to wear a mask or physically distance in any setting except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidance. Update that fully vaccinated people can refrain from testing following a known exposure unless they are residents or employees of a correctional or detention facility or a homeless shelter. Discuss.
That's a tough one. You know, if you listen to Ryan, I know everybody's hanging on every word, but we have a fair level of viremia in this, you know, in this county, at some of the highest rates of viruses. And yeah, it's good. I agree with it. I mean, the guidelines are not specific enough. Obviously, if you haven't, you know, if you feel like you got COVID and you've been exposed, be tested. You know, come on. And if somebody in that setting, if they would not do well, if they were exposed to you, if you happen to be, you know, transmit the virus, like the autoimmune or under chemotherapy or something, then still mask. I mean, this is not rocket science. It's not even exceptional public health. It's just kindness to others. And so there will be some further guidelines, I think. And as we talked about when we first started this call, if you you're on an airplane, you know, wear a mask. If you're in tight settings where there's not much physical distancing, it's not inappropriate to wear a mask. As Glennah mentioned, we've seen some outbreaks. You know, some people who have been immunized who have actually gotten COVID. Thankfully, it's not been serious cases. Nobody's ended up in the ICU who's been vaccinated. But just because you've been immunized doesn't mean you're totally immune to getting an infection. So, you know, still hand washing, some physical distancing, particularly in indoors, you know, in poorly ventilated settings. You know, it's just, again, it's common sense. I know we see these rules from CDC, but our county still has high rates of transmission. Ryan?
I was just going to add that caveat, unless it's required by state and locals. Right now, it still is required by the state. I know there were some news reports about the governor potentially loosening that. He clarified yesterday that they may indeed continue to be required after June 15th. But as has been the case throughout this, typically CDC comes out with something, and then CDPH follows up. The California Department of Health follows up with state-specific requirements and guidance related to that. So we'll have to wait and see what the state does with that information.
you know. And the more that people get vaccinated, the rarer the virus will get. So there's no question that getting vaccinated is the way to getting to have more normal activities. I think that is why I'm hoping we will see a large number of 12 to 15-year-old kids getting vaccinated so that they can get back to their normal activities safely. But we do need to do what's safe, regardless of what the CDC says. And when we have substantial amount of virus in our county, it's not as safe as when it's rare. You know, if we were to get to the place where you're not likely to encounter somebody with COVID-19 in a crowded place, then it'll be safer to not wear a mask, whether you're vaccinated or not. So I think the message is, yes, it's safer for vaccinated people to do things that unvaccinated people can't. But the message is, let's all get vaccinated so that we don't encounter the virus in our normal activities.
And we all want to get there. I mean, there has to be some benefit to having been vaccinated, but what that means at this moment is very different in a county like ours, where you have just over 50% of people 18 and over vaccinated, and a county like Marin, where they have great uptake, where there's over 80% of people over 18 have been vaccinated. So the safety of doing those things is going to be much greater in the communities that have greater uptake. So we need to do everything we can to get our community there.
And getting the community there. So again, there are now walk-ups available, and also the Sierra College, that clinic also functions on Saturdays. So that's important to repeat, that people on Saturdays, if you drive by Sierra College, you can swing by and you can get, and I believe that's the Moderna vaccine, you can get that. So that is not yet approved for juveniles, but that is still just at the Whispering Pines Clinic and Docomo's. But you can drive by, and hey, and if you have everybody in the car, you can have the whole family. You can walk in and get vaccinated, and in case of the Pfizer and Moderna, 2 weeks after that, you are considered fully vaccinated, because it was one of the things that the fully vaccinated. Well, I got my second dose. It's like, yeah, but there is still this 2-week period that we talked about, I believe, last time, that it takes to kind of sort of have your immune system actually kicking into gear and be aware of the virus, and in case it would come. Interesting that you mentioned that we had breakthrough cases in Nevada County. That's it happens, and so that nothing is completely and utterly fail-safe, which actually is one more reason to maybe just continue to wear your mask if you're in a setting where you don't know if everybody's vaccinated, or just some indoor setting. So actually, I was actually pretty glad that the board meeting on Tuesday was outside. It was an incentive for me to actually show up, because indoors I'm not sure that I'm ready to be in the same room with people where if I don't know if they're vaccinated or not. And not to mention, it's a Board of Supervisors chambers being a rather closed-in room with no, and I know a little bit about the HVAC system in the Root Center, so thanks for having it outside. Al fresco was nice. It was a nice sunny day for the most part. One question that came up, and it's something that we actually haven't talked about, and I was surprised that we that we never did, is people with long COVID. So we get several questions from people that call themselves COVID long haulers. First of all, they want to know, am I the only one? Are there other people in Nevada County? And then what is it safe for them to be around others that are both vaccinated and unvaccinated? And should they limit their contact periods because their immune system is still pretty compromised? So what can you tell the long haulers?
So I'll go ahead and get started, and then Scott can correct me. First of all, I really feel for people who have long COVID. And we're learning more about this disease as we go along, but it appears that about 10% of people who get the infection end up having long-term symptoms. And it doesn't seem to be related to how sick you were initially. There are some people who had no symptoms that later on developed symptoms that are long-term. And because we haven't known this disease long enough, we don't know how long this is going to be. Is it going to be just lots of months that you feel miserable? Is it going to be a lifetime? We simply don't know the answer to that. And no, you are not alone. If you have long-term symptoms, in Nevada County, we know of lots of people, unfortunately, that have had long-term symptoms. I believe that Tahoe Forest Hospital is developing a clinic for folks that have long COVID in the east side. In the west side, unfortunately, we do not have, that I know of, a clinic. Maybe somebody will correct me, for long COVID, but UC Davis in Sacramento does. And I know that some of our providers have referred their patients to the UC Davis clinic in Sacramento. By all means, talk to your provider. We can also do some research. I believe that there are some groups for support of each other that some of our providers know about. But yes, long COVID is real. There, about 10% of people get it. And we hope that research will tell us how to treat it and how to get people back to normal. Two things. Because you have long COVID doesn't mean that you have long-term infectiousness. The infectiousness for people with normal immunity is about 10 days from the time you develop symptoms. For people with decreased immunity, it's about 20 days. But just because you have long COVID doesn't mean that you can infect other people months afterwards. So you can be around other people even if you have long COVID, and you can get the vaccine if you wish to have it. And anecdotally, we've heard of people who had symptoms that got the vaccine and got better. Don't know if that's true for everybody. Don't know if it's just anecdotes, but you can get the vaccine if you have long COVID. And I'll stop there and see if Dr. Kellermann wants to add anything.
Yeah, Glennah, you covered it really well. You know, we thought it was more. We thought it was closer to 30% of people that initially, but it turns out research is demonstrating it's closer to 10%, so 1 out of 10, and it is not related to symptoms, although the people who have more symptoms tend to be ones that are more likely to get it, but still it can affect people that have relatively minimal symptoms, and it's not subtle. You know, these you know, I was active, I was running marathons, and now, you know, I get winded when I walk out my front door. Or I was you know, working in my job and doing, you know, and I was a trusted employee, and now I can't go to work anymore. So these symptoms are devastating. We think it's probably more of an autoimmune kind of inflammatory condition, and, you know, probably similar to something about Lyme's. You know, when people get a Lyme infection, it clears, you know, the Lyme, but, you know, sometimes they have longer symptoms. Therapeutically, it seems like the one thing that does work pretty well is being immunized. Kind of strange, but it works. And about 30 to 40% of the people do have a marked response to immunizations. I see Alinea is here. She knows all about this stuff. You want to comment, Alinea?
Yeah, no, I agree. I've seen patients with really long-term COVID symptoms get the vaccine and some of those symptoms getting better. And so that's been really encouraging, because there's not a lot of treatments that we have that are proven for some of these long-term symptoms, which include like disabling fatigue, shortness of breath. I've seen people get new onset diabetes and heart failure. And it's scary. And it's scary for the patients, because again, we are all trying to figure out how to treat that best. So yeah, I think that we are seeing more vaccines offered now for 12 and up. So that's really exciting, because we do want to prevent disease in our kids. There have been kids that have died from COVID as well. I think it was like 128, and that's 128 preventable deaths that we could have prevented for our child. There are rare side effects like MIS-C in kids as well. And, you know, there's other things. The leading cause of death in kids is suicide, and not being able to go to school because of this pandemic is, you know, been really hard on kids. So as soon as we can get back to that new normal of ours and get our kids vaccinated and get through this, the better.
Yeah, definitely more the more we can get back to normal, the better. I mean, I think everybody, I think that's the one thing that we can all agree. It's like, yeah, we all want to get back there, and 40% or however many people are fully vaccinated now for Nevada County. I believe it is 43% of the population of over 18. That's still 57% that are not. So 57%. So there's 100,000 doses would be great. 200,000 doses would be better. That would be much better, because then that would mean we actually have everybody immunized. But that's just a pipe dream. We have a question from Janice here in the Q&A section. Is there any data available for the number of breakthrough infections as a percentage of those vaccinated? And also, if the data is available, how does Nevada County compare with other counties?
So Nevada County is about the same as other counties. The Pfizer and the Moderna vaccine in the lab were 95% effective in preventing infection, which means that 5% when 5 out of every 100 people will have a breakthrough infection even if they're fully vaccinated with one of those vaccines. The Johnson & Johnson vaccine is a little less effective in the sense that about 69 to 75% effective. So 25% of folks, 25 out of 100 people who get the Johnson & Johnson vaccine might get the infection. We are seeing breakthrough infections in Nevada County. According to the state, to the California Department of Public Health, it's no higher than everywhere else in California. And they believe that some of this is due to variants that are circulating. And we certainly have variants. The 2 Western variants and the United Kingdom variant have been identified in our community, and there may be other variants circulating that might add to this breakthrough, to these breakthrough infections.
The state shared some statistics statewide, and this is a couple days old, but out of 13.5 million fully vaccinated individuals, there had been 3,600 or so post-vaccination cases identified. So that's not the study setting where they're constantly testing people. So that's a very low percentage, 0.026, but and then 150 individuals hospitalized with COVID post-vaccination. So it's definitely possible, but very rare compared to the number of vaccinations.
And this is so much higher than any other vaccine we've ever had. So it's really amazing that we have a vaccine that's so effective, that's like 0.2% breakthrough. And we're not seeing people die after getting vaccinated from COVID, which is huge. And even if they are hospitalized, it's a lot milder symptoms, and they're making through it.
So just one thing, going back to the having vaccines now available for kids 12 to 15. Is it the case that the parent or guardian needs to both make the appointments and take the youth to the appointment? And just to clarify that right now that's for Pfizer only, correct?
So, yeah, I can speak for the public health clinics, and it's an ongoing conversation, and this may change, but right now, we would want the guardian or parent to be with the child when they come for their vaccine. Other providers may have other options available. And we know that in other counties, they're talking about allowing a child to come with written consent from the parent and then confirming by telephone. That's not true in Nevada County public health clinics yet. But legally, this vaccine requires for minors a parent or a guardian's consent. The minor themselves can't consent for this particular vaccine. And I'll let Dr. Stevens speak or Dr. Kellermann about any other requirements.
I agree. The same thing at Chapa Day. We don't have the Pfizer vaccine yet, so we're working on that part.
Yeah, there's other counties that there's a written agreement and the parent or guardian signs it's adequate. And here we've kind of raised the bar because we want to make sure that the parents are engaged in the decision making. If we find that's not necessary, then we'll drop that requirement. But for now, and we're hoping to open up the clinics to, it'd be a little bit more user friendly. Maybe get a Saturday clinic, and we've been discussing with the pediatricians how we can get vaccines to their hands, and the primary care providers. They're the best option for getting immunizations. I mean, no 12-year-old is going to go to a pediatric visit alone. So, we're hoping to make it very user friendly, where people have easy access to immunizations at any time.
And one thing that parents should know is that the requirement that this vaccine be given all by itself with no vaccine 2 weeks before and or 2 weeks after the dose has been removed by the CDC. So if your child needs to be caught up on other vaccines, by all means, make an appointment with your regular doctor. As Dr. Kellermann says, we're hoping to get the Pfizer vaccine into the hands of your regular doctors so that if your child goes in for their catch-up immunizations for school, they can get the COVID vaccine there too.
And I believe that next Thursday, we will have a couple of pediatricians who will tell us all about it. And by then, maybe the logistics, because Pfizer, of course, is the vaccine that needs the ultra low cold storage. So I believe that there's definitely logistics issues that have to be worked out to get the vaccine into the practices of the pediatricians and other physicians. But that's something else that public health is working on, and I'm assuming.
We are. I talked with Mike Curtis and Sarah Warner here just yesterday. They're itching to be on your show, Pascal. And they say the more difficult the question, they'll rise to the occasion. So make sure people tune in next week. It'll be
I'll make sure to remind them that you said that. So we are, well, hey, we've already been at this for close to 30 minutes. So as usual, I'm going to ask for your parting shots of wisdom.
Glennah, you want to start out?
Sure, then I don't have to follow you. You always have such great things to leave us with. So yeah, just please continue to be safe. This pandemic is not over. We are at the home stretch, but if you're not vaccinated, wear your mask. And if you want a vaccine, please go on My Term. There's plenty of places that you can get one.
I was on a call with the other providers. Alinea was on the call, and Hippocrates, the father of all medicine, said, cure sometimes, treat often, and comfort always. We tend to look at the cure and the treatment, but that's maybe not the focus of reason that we're here today and the reason we live in Nevada County. It's the comfort of one another. So I would suggest, reach across the aisle. We see people that have different opinions, but the hearts beat the same. So let's see more of that and less squabbling about issues. Thanks, Pascal.
Anyone else?
Well, that's hard to follow, but I'm on the vaccinate side, and I would recommend don't wait. If you've decided to get vaccinated, do it as soon as you can, because the sooner we reduce the amount of virus circulating in our community, the sooner we'll all be back to normal.
And if you reach across the aisle, please wash your hands before and after.
Good point.
Just asking. With that, thanks so much, everybody, for joining us. Thank you to our panelists. Thanks to our attendees. And we're going to go and put this now on YouTube. And we will see you again next Thursday, same time, for the latest update. Thanks again, and have a good one.